Hello, everybody. My name is Lee Gerasi. I'm a general surgeon at St. Elizabeth Healthcare in Northern Kentucky. Today, I'm going to be presenting on Stop the Bleed. Stop the Bleed is a course that came out of the Sandy Hook shootings. You know, obviously, no one wants these sort of events to happen, but as physicians and especially as surgeons, we want to be ready to respond when these situations do occur. So a number of organizations came together, the Hartford Consensus, the Committee on Trauma, the American College of Surgeons, and the National Association of Emergency Medical Technicians, the Committee on Tactical Combat Casualty Care, American College of Emergency Physicians. And they wanted to try and create a course that would teach the average person what to do in the event of massive traumatic bleeding. And what they developed is this BLS style or CPR style course, which has a didactic component, which is this presentation, and then a hands-on component, which unfortunately with COVID restrictions, we're not going to be able to do at this time, but we can always do at a later time to complete the certification. But this course is designed to teach the principles of how to stop bleeding as well as the skills to do so. Because this deals with bleeding, some of the images during this presentation may be disturbing. Again, since I'm speaking to a medical audience, I don't think they'll be too shocking, but just be aware if you're eating something as we're going through this, some of the images may disturb your breakfast, lunch, and or dinner. So why do we need this training? And here I'm going to take a second and pause. The presentation that you're going to see is designed for the lay public. It is not specifically designed for medical professionals. I myself first received this training at my national convention. A trauma surgeon that I'm friends with got up in front of a room full of surgeons and said, I'm going to present this the same way I present to members of the community. And the reason for that is, number one, we want you to become instructors. So after you take this course, I'm going to show a listing of certifications. If you have any of those certifications, you're able to reach out and become an instructor for Stop the Bleed. So we want you to become an instructor, and this is the presentation that you would use to present to your community. Therefore, this is going to be your training. In addition to your personal training on this topic, it's going to be the training for you to see how the presentation is given. You can critique my way of doing it and say I can do it better. That's great. Or you can say, hey, I kind of liked some of the anecdotes that Lee shared, and I'm going to use those. So this presentation at times may seem basic, but again, that is on purpose. I want this to be the same thing that you would give to the community. So why do we need this training? The number one cause of preventable death after injury is bleeding. One of the images that I'll always tell the audience to think of is, a big jug of water with the spigot, and you open the spigot and it starts running out. And especially when you work in a hospital, you get used to having a blood bank and being able to call for extra blood when you need it. But when you're out in the field, you don't have that option. So you want to keep everything that the victim has inside them, and preferably in the proper place inside them. So we want to make sure that we know how to address bleeding. Where can I use this training? Again, I think unfortunately what makes the news the most are school shootings and other workplace shootings, but really anywhere. It's getting into hunting season, especially here in Kentucky, and so we're going to have a lot of people out in the woods with firearms. We're going to have people up in tree stands, heavy industry, car accidents, natural disaster, any of those things, and even just things around the house. I got a phone call from a close friend saying that he cut himself pretty deeply with a knife and what to do. And so I walked him through how to stop the bleeding over the phone, and he was able to get to the ER and get taken care of. So these are things that the principles are going to apply really to any situation. But again, this came out of the Sandy Hook shooting and the goal that if we can't prevent those situations from happening, at least we can prevent the unnecessary loss of life after them. So what are the goals? The first is to be able to identify and recognize life-threatening bleeding. And the second is to stop the bleed. So take the steps to stop the bleeding. And those steps include pressure, packing, and applying tourniquets. So, one of my first steps into medical training was to become an EMT. And one of the first things that they kind of drilled into you is you don't want to create a second victim if you can help it. So first thing you do when you enter a scene is assess for the safety of the scene and your safety. So remember, your safety is your first priority. If you're injured, you can't help others. And if you're injured, when the EMS, paramedics show up, police, fire, and rescue, they might decide to take care of you and someone else might lose their life because they were more critically injured. So remember, keep yourself safe. Don't increase the number of victims at the scene. Help others only when it's safe to do so. So, again, there's a variety of situations: unstable car accident, fire, other things that can make it more dangerous. But again, think about your safety. If the situation changes or becomes unsafe, stop, move to safety. If you can, take the victim with you. So, again, one of the medical principles we're always trained in is, stabilize the neck, prevent any unnecessary movement. But if they bleed out in place, then it's not going to do anyone good. Or if they're the victim of a second traumatic injury because they were left in an unsafe spot. So, again, all of these competing principles are important, but at the end of the day, you're trying to do anything you can to keep yourself and the victim safe. So again, bloodborne disease is unfortunately something that we all deal with today. So things like hepatitis C, HIV, these are things that you want to make sure that you protect yourself against. So wear gloves if you're able to. If you do get blood on yourself, make sure to clean any part of your body that the blood has touched. Tell a healthcare provider that you got blood on you and follow his or her direction. It is typically a state mandate in the 2 states I've ever practiced medicine, but that your safety is important, and therefore if you're exposed, then you can get the blood tests to make sure that you were not exposed to something that the victim may have had, or that the victim was not exposed to something you may have had if you were both bleeding at the same time. So again, always think of your own safety. One of the things we're going to cover in this course are trauma first aid kits. These trauma first aid kits are available from a number of vendors, but typically they'll include some sort of packing gauze, plus or minus. It'll have some sort of hemostatic agent attached to it. You can also have, it'll have a tourniquet, it'll have a marker, and it'll have gloves. So, after learning about this course and beginning to be a teacher for this course, I have put a trauma first aid kit in all of my cars. We have one in the house, so we've kind of got them all over the place. So again, always think about your safety. So what are the ABCs of bleeding control? So the first thing is call for help. So alert 911. This is going to start the timer on how long it is until you have additional help. So the sooner that you get that activated. And if you've ever taken CPR, one of the principles in that is if you are busy administering aid and there are other people present, you'll make eye contact with that person, point at that person and say, you, Dave, Joanne, whatever their name is, or just you if you don't know their name. Call 911, but make that eye contact so that it becomes a directed, this is your responsibility. B, bleeding. So you want to identify where the bleeding is coming from, and C, compress. So get it to stop. We talked about making sure that you alert 911. Again, you can put your phone on speakerphone and continue to administer aid, but make sure that you've started that clock on how long it's going to be you by yourself or with minimal help and resources before you've got the professionals there. When you call 911, obviously always helpful to know your location. Follow any additional instructions provided by the 911 operator. Give them an assessment of, everything that's going on, number of victims, what happened. That way they can send appropriate help. And bleeding. So now we're going to identify where the bleeding is coming from, what kind of bleeding it is, and the best approach to get the bleeding to stop. So we're going to look for a source of bleeding. We specifically want to look for continuous bleeding. We want to look for large volume bleeding, and we want to look for pooling of blood. One of the basic tenets of trauma surgery is you always want to look at every inch of the patient, and I can tell you, having worked in trauma bays, there are still times that you get distracted by things, and sometimes it's the blood dripping down the side of the gurney before you realize, oh, there's something else going on that we haven't identified yet. So, in these real world situations, you're not going to have all the fancy equipment that's available in a trauma bay, but you still have the ability to just look for these signs that something bad is going on. There may be multiple places that the victim is bleeding, particularly if this is the result of a shooting and there are multiple gunshot wounds. Clothing may hide life-threatening bleeding, so this is not a time to be shy. If you see blood on the clothes, you need to open the clothes and be able to visualize, is there a wound underneath that might be bleeding that you don't realize? You want to try and roll the patient in, check their back, make sure that there's not a through and through wound or a penetrating wound that doesn't end up going through the other side and you don't see it. So now we're going to talk about location-based approaches to bleeding. So for the arms and legs versus your junctional wounds, such as the neck, armpits, and groins. So you can see that the arms and legs are outlined in blue, the junctional wounds are outlined in green, and then we've got the kind of core or main portion of the body there in we'll call it orange. So now, how do we compress, stop the bleeding, add that pressure? As a surgeon, one of the long-standing rules of surgery is all bleeding stops. It does tend to stop in the preferable way if you put a finger on it and just get it to stop that way. So for compressing, adding pressure, you're just going to apply direct pressure to the wound. You want to focus on the location of the bleeding. Use just enough gauze or cloth to cover the injury. This is something that I see people often get wrong in the hospital. There becomes this focus on adding more and more gauze until when you think about it, your pressure that you're directing onto that wound is being diffused by the amount of gauze between your hands and the wound. So really you just need a little bit there to maybe promote some clot, keep your hands from being directly on the wound, but otherwise just enough. The direct pressure piece, this is not something that, unless you've practiced extensive isometric exercises and you're got some pretty impressive grip strength, you want to make sure that you use your body weight. So one of the things I always instruct people to do is, just like you do for CPR, hand over hand, and then straighten your arms and get your body weight up over that. Is it going to hurt the person? Yes, it is going to hurt the person. I mean, they have a wound there, and that's why they're bleeding. But if you don't hurt them to help them, then they may die. So you want to make sure that you have that direct pressure to the wound. You're using your body weight so that you can hold that pressure. And then if the pressure stops the bleeding, keep the pressure on the wound until help arrives. In the operating room, if we have bleeding and we need to use pressure to stop it, I will look at the clock and I will just sit there and we will talk until that time has come, and then we will look, because every time you take the pressure off, the bleeding restarts, and then you've got to start the process all over again. That's in an operating room where I have control over the situation. In the real world, you want to make sure that you're not losing any more blood than you have to, so you just keep the pressure until the experts arrive. It was interesting, again, when I did this class for the first time, this was a group of surgeons. I mean, it was a surgical conference. The only people in the room were surgeons. And one of the questions that the instructor asked is, well, when do you stop holding pressure? And there were a variety of answers. When the bleeding stops, when I get them to the operating room, whatever. And he said, no. He said, you hold pressure until EMS gets there. And he said, you're a bunch of prima donnas and you need your particular scalpel and your particular gloves and everything else. And he's like, no. He's like, your job is to be in the operating room when they arrive, and then you do your job there. EMS, paramedics, fire and rescue, police, they are trained to work in the field. He said, you hand it over as soon as they get there and they take ownership of that patient. He said, don't be the one that's arranging or guiding things unless that's what you do for a living. So again, keep the pressure on until help arrives. So here's a video that's showing a wound on a victim, and you can see that the rescuer is taking a t-shirt putting just enough over top of it, crossing their hands just like they were doing CPR, getting their weight up over top of their extended arms and holding that pressure. They're not lifting it to check if there's bleeding or not. They're just holding pressure until someone arrives. One of the questions that I've received several times in giving this presentation is, well, what should you use to hold that pressure? You know, how clean is clean? Well, I mean, obviously we have the standard of sterile gauze. That would be our ideal situation. You know, in the absence of that, any clean cloth will work. And in the absence of that, again, we've got good antibiotics, and I'm happy to clean out a wound that gets contaminated if you use a dirty cloth. The most important thing is just keep them alive. We'll take care of it in the hospital from there. So this demonstrated that holding pressure and good technique of hand over hand and weight over top of your hands. So what about larger wounds where superficial pressure is not effective? So for that, you're going to use packing. So if you have bleeding from a deep wound, you're going to pack gauze tightly into the wound until it stops the pressure, or until it stops the bleeding, holding pressure until help arrives. So you can see in the B example, just by putting gauze over top, you're not actually compressing where the bleeding is happening deeper in the wound. And so the technique for A is showing that you get the gauze all the way down and fill that hole and then put your pressure on it. And now that gauze will exert that pressure down deeper into the wound. Now, one of the things that we kind of show you during the practical portion of this course is pushing your finger down, getting more gauze, and then swapping out fingers. So you don't want to shove gauze in, pull your hand all the way out, because now the bleeding continues. By kind of doing a hand over hand, so pushing one hand in, putting the other hand in as you pull more gauze in, it continues to hold that pressure. So even as you're packing the wound, which shouldn't take that long, but even as you're packing the wound, you're also holding pressure to get it to stop bleeding. So here's going to be a demonstration of that. So here they're opening the quick clot gauze. So this is gauze that is coated in a hemostatic agent. So not only can you pack, not only does it work just as packing gauze, but it also works to promote clot formation. So you can see how she's holding pressure, pushing fingers down as more gauze comes in. So there's really only pressure off of the wound for a short period of time in between each section of gauze. And one of the things that you never realize is how much you can actually shove in there. So you just continue to push it in until it's tightly packed. And then again, you see hand over hand, shoulders over hands, weight directed over that, and you hold pressure until someone arrives. Packing is going to be particularly effective for any of these locations, but especially at the neck, armpits, and groin, and then for the body. The reason being is as we move away from the extremities, tourniquets are not an option. And so in those areas, especially if you have a penetrating wound with bleeding, your best bet is going to be packing to help control that bleeding. So it's effective in any of the locations, but particularly as you get to the neck, armpits, and groin, those junctional areas, and then the body itself. So what about a tourniquet? So the purpose of a tourniquet is to stop bleeding. These tourniquets are different than the tourniquets that are used when you go in to draw blood. Those are venous tourniquets, so they're only designed to put enough pressure to stop the vein from allowing the blood to flow back to the heart. With these tourniquets, these are arterial tourniquets. So these are designed to tighten down and overcome the pressure that's in the artery blood system, which is the higher pressure. So these should be applied at least 2 to 3 inches above the wound. The reason for that is arteries have elastic, and if those arteries are damaged, that elastic in the artery is going to cause it to pull away from where the wound is. So if you place a tourniquet right at the wound, you may not be getting the adequate compression that you need. You may not even be compressing the vessel at all. You don't want to place these over the elbow or the knee. So when you think about the legs or the arms, the lower leg, there's 2 bones present. The lower portion or the outer portion of the arm, there's 2 bones present. The upper portion of the arm, the upper portion of the leg, there's one bone present. When you look at the elbow or the knee as a location, now you have three bones that are going to be in the way of the tourniquet being effective. So you want to try and have the least amount possible within them. And you're going to tighten the tourniquet until bleeding stops. If you've ever woken up in the middle of the night and your arm is asleep, and then you move your position and your arm starts tingling, and then it kind of goes through that burning, and it kind of tells you how long you've been sleeping on it, that's what a tourniquet feels like, multiplied by 100 and continued on until they stop bleeding and the tourniquet is removed. They're not going to feel good. It's going to hurt like hell. That's one of the ways you know the tourniquet's been properly applied, besides the fact that the bleeding stops. You do not remove the tourniquet. There is no benefit to opening the tourniquet to quote unquote let the blood flow. Again, think of that jar of water. You only have so much, and every time you open it up, there's no way to replace it until the person is at a hospital. So do not remove the tourniquet. Once it goes on, it stays unless the EMS shows up and they decide to take it off. But chances are, unless it was applied incorrectly, they're not taking that tourniquet off. They're going to keep it in place. Tourniquets can be applied to others or on yourself. One of the benefits to combat medicine is that we've learned improved ways to keep our soldiers alive. And so these tourniquets are designed that you can place them on yourself and you can put them to good effect on yourself. They can be applied over clothes. Again, ideally not. You want to make sure that if the person has keys or phone or something in their pocket, that you have that out of the way, because again, that's going to be something that prevents them from being effective. Again, and I can't stress this enough, tourniquets hurt. After you apply a tourniquet, if that's the only victim you're taking care of, the rest of your time may be spent just trying to keep them calm and keep them from trying to pull the tourniquet off. Again, when EMS and paramedics arrive, they have great drugs that will help that person. And if they're alive to hate you, then they're still alive. But chances are, once that tourniquet's off and they've been taken care of, they're going to appreciate what you did. A second tourniquet may be required to stop the bleeding, so don't be afraid if you have adequate supplies, if the first tourniquet did not stop the bleeding, to apply a second tourniquet. Again, remembering you want to have that at least 2 to 3 inches above the wound, and above the wound I mean closer to the body. So if the wound is on the ankle, you can do the lower part of the leg, you can go all the way up and do the upper part of the leg. If the wound is around the knee, then you've got to have 2 tourniquets up above the knee. We're going to watch a brief video on applying a tourniquet. So, placing the tourniquet on, you also have the option of just keeping it in a loop and sliding it up the extremity. But if the extremity is broken, let's say, and that would cause undue pain or you're not able to, then you can go ahead and just do this way. You can see that they're tightening it as much as they can, so taking up all the slack. And now they're turning the windlass rod. So the windlass rod applies the additional tension, and now they've locked that in place. They're bringing the strap across and around to help hold that pressure, and then they're putting this time strap. Now with that time strap, in the trauma first aid kits, there is a marker. You are going to put what time you applied this. That way, when the patient gets to the hospital, we know how long the tourniquet's been in place, so we can take appropriate preventative measures from some of the downstream problems that can occur from a tourniquet. So there's a number of different tourniquets. There's the soft TTs, there's the CAT tourniquets, there's the SAM XTs, the TX3s, the RMTs, the TMTs. The CAT tourniquets are the standard tourniquets that are used in the official bleeding control trauma first aid kits. They are typically the tourniquet that you will see in the commercial kits. I'm a big fan of the SAM XT. Of note, I have no financial disclosures. I just like telling people when I find something I like. The neat thing about the SAM XT is those dots that you see on the strap. You pull, and as soon as the appropriate amount of tension is reached, meaning that you've taken up all the slack, then there's 2 little plastic teeth that pop in and lock it in place. So it becomes very easy and intuitive to use. So I've become a big fan of those. Those are the type of tourniquets that I have in my car. The Commission on Trauma and Combat Care Medicine, these are recommended limb tourniquets. So, if you are in a doctor's office and somebody starts bleeding, you can always use a blood pressure cuff and just crank the pressure up as high as it takes to get the bleeding to stop. But these are all the different tourniquets that are recommended. So again, the CAT tourniquets, which are the combat application tourniquets, the SAM extremity tourniquet, the ratcheting medical tourniquet, and again, there's a lot of varieties. Whatever you have, just make sure you're familiar with it. They all use the same basic principle of a strap that secures itself with Velcro, or again with that little clicking teeth. It has a windlass rod. It has a place to capture the windlass rod, and then you have a time strap so that you can label how long it's been on. Here are some of the pneumatic ones. So these are ones that are actually going to use air pressure to go up. So bleeding control in children. In all but the extremely young child, you can use the same tourniquet that you do for adults on children. For an infant or a very small child where the tourniquet is too big, direct pressure on the wound is probably going to work because they're so small, and the pressure in their vascular or their blood vessel system is going to be the same. For large, deep wounds, wound packing can be performed in children just as in adults using the same technique that we previously described. So, frequently asked questions, impaled objects. So, impaled objects, you want to leave those in place because they may be serving to stop any bleeding. So you stabilize it. Again, if for some reason you can't move the person without the impaled object coming with you, it's not going to come with you if you try and move the patient. Again, if they're stable, just keep them in place. If it's unsafe, and you think you can pack it, again, it becomes those very difficult judgment calls. But in general, the rule with impaled objects, leave them in place. What about improvised tourniquets? So the Boston bombing, the Boston Marathon bombing, that's a great example of people just doing whatever they had to do to help their fellow human being. And so they were using, there's one guy who had a roll of electrical tape, and he saved several lives because he just wrapped the electrical tape as an improvised tourniquet. Again, as the saying goes, needs must. So if you have to do something, it's better than nothing. But the problem with improvised tourniquets is there is a risk of injury to the person just because it's improvised, whether it's from them continuing to bleed or damage to the tissue. They're not ideal compared to a true tourniquet. What about loss of arm or leg? So a properly applied tourniquet and someone who gets medical attention in an urgent fashion, they're not going to lose their arm and leg. Modern medicine is too good at that now. And this is the proverbial life over limb. So if we're having to sacrifice an arm to keep the person alive, that's the decision you have to make. Again, hopefully it doesn't come to that, and you should rest assured that if you use a tourniquet and the person gets to the hospital, if there's any chance, they're going to be able to keep that arm or leg. Pain, yes, it's going to hurt. All of these are going to hurt. If you're putting a cloth over top of a wound, you are proverbially rubbing the salt in the wound. If you put a tourniquet on, again, take that numb, tingling feeling you get in your arm and multiply it by 100. So you have to be prepared to, again, after you apply a tourniquet, to basically keep the person's hands from trying to yank the tourniquet off. We're going to have a Q&A session so I can answer any questions live, but those are kind of some of the things that I typically get asked about during these presentations. So the summary of everything we talked about, first and foremost, again, look out for your own personal safety. Do not become a second victim at the scene. Do not make EMS make the decision about whose life they have to save if it comes to that. The ABCs, alert 911, find the bleeding, compress with pressure and or packing, or compress with a tourniquet, wait for help to arrive. When the experts arrive and they take over care, then again, if you're a physician, get to the hospital so you can be there to receive them and do your job in your environment. but the experts in the field are going to be fire and rescue, EMS, police. If you are interested in becoming a instructor, we would love to have you. The requirements to become an instructor are that you take the course, you complete the actual skills portion, which again, we can work on arranging as COVID allows it. But if you go to stopthebleed.org, they have a listing of all of the different certifications. That includes physicians, that includes physician assistants, PAs. Interestingly, it's a very wide range. So physical therapists are on there, nursing, obviously. One of the ones I always thought was interesting was ski patrol. Veterinary technicians, I believe, are on there. So really, if you have any background in, helping people, you can become an instructor. Stopthebleed.org also has materials. I will tell you up front, their trauma kits are more expensive than you can buy anywhere else. Again, if you like their logo, you can buy it from them. Otherwise, you can go on Amazon and any of a million other retailers and get those. The big thing to remember is the only thing more tragic than a death is a death that could have been prevented. The Stop the Bleed program has been effective. There are a number of positive stories that have come out of the unfortunate shootings that have happened. One of the notable ones is the synagogue in Pittsburgh, Pennsylvania. There were a number of lives that were saved that day because Stop the Bleed principles were put into place by the community, by first responders, and as a result, that disaster was not as bad as it could have been. So thank you very much for listening to this presentation. I'll be on to do some live Q&A, and like I said, we can work in the future to get the skills portion set up so you can become certified. Thank you.